Disclosures for this and all episodes in this series can be found on the podcast series destination page located on education.webmd.com. The following presentation is copyrighted by WebMD Education. No use, broadcast, or recording of this presentation or any part thereof is permitted without the written authorization of WebMD Education. The following podcast is supported by an independent educational grant from Moderna, Inc.
Hello, I'm Dr. Greg Poland, Professor of Medicine and Infectious Diseases at the Mayo Clinic in Rochester, Minnesota. Welcome to this podcast episode entitled, Why Antibiotics Can't Be Used to Fight a Viral Infection. This is part of the 6-episode podcast series, What to Know About COVID-19, the Flu, and RSV. Today, I'm speaking with Dr. Deborah Goff. Dr. Goff, can you tell us a bit about yourself and the work you do?
Sure, thank you. I'm Deborah Goff, an infectious diseases clinical pharmacist and professor at The Ohio State University Wexner Medical Center in Columbus, Ohio. I am one of 25 global healthcare experts selected by the World Health Organization to educate and implement antibiotic stewardship programs worldwide to assure antibiotics are only used when necessary and appropriately used. I really love teaching and educating people about infections, so I'm very excited to be with you today and talk about a topic I'm very passionate about.
That's great, and we're pleased to have you with us because we're going to be talking today about this very issue, about respiratory viral infections and why antibiotics should not be used to treat them. And perhaps we should just kick this off with a definition of what a respiratory viral infection is. This is a general term we use for any infection that is caused by a virus in your respiratory system. That's your nose, your sinuses, your throat, your airways, and your lungs. And it's important to know that some of these infections tend to happen or stay confined to the upper respiratory tract, but others can start there and affect other parts of your respiratory system. The common cold is an example of one of those viral infections that's usually limited to your upper respiratory tract. So your nose, your sinuses, your throat. And that's often caused by a group of viruses called rhinoviruses. But then we have other respiratory viral infections, such as influenza or the flu, which sometimes infects your nose, throat, and lungs. And this can be caused by several different types of influenza virus. And then there's respiratory syncytial virus, what you'll hear called RSV. That also infects your nose, throat, sinuses, airways, and lungs. But we also have some viruses that cause a respiratory viral infection that can damage many different organs and systems throughout your body, not just the respiratory system. And we're seeing that with COVID-19. This is a respiratory viral infection caused by a type of virus called coronavirus. And then we can have pneumonias, which is interesting because it's lung infection that can be caused by several different viruses or bacteria. But that's a different type of infection when it's caused by a bacteria. So there are different types of organisms, bacteria, viruses, and others we won't get into today. And it's important to know that these are different from each other. So maybe this is a place, Dr. Goff, where you can tell us a bit about the differences between viruses, bacteria, and why that's important information when you're sick and seeking treatment.
Sure, I'd love to. Well, let's talk about exactly what is a virus. They are different from bacteria, and we've all become very familiar with viruses because COVID-19, the global pandemic, is a virus. So viruses are very small organisms. They're so small you can only see them with a microscope. And they're very common. They're everywhere. And viruses have a core that makes up genetic material. It's either DNA or RNA. And viruses are surrounded by a protective coat that's made up of protein. And so there are some types of virus that have an additional spiky coat around this outside called an envelope. And with COVID-19, we've often seen all those pictures with the little spikes sticking out on the surface. It looks like a crown or corona, and that's actually how it got its name. But a virus doesn't have everything it needs to replicate or duplicate, meaning making more viruses. They can't do it on their own. They have to attach and enter or infect the cell of a host, and that host is ourselves, the human. And so they use that host cell equipment in order to do so. And oftentimes the virus can severely damage or kill the host cell.
And that's exactly right. These viruses need host cells or are our cells to keep multiplying and infecting. And without those host cells, they can't infect and they don't have the ability to spread, and it can't make copies of itself. So this is going to be important when it comes to treating infections caused by a virus, because viruses are pretty hard to kill sometimes, especially when they're already inside your body and multiplying. And often what we're doing is interfering with the virus's ability to infect your cells or multiply. This is not like a disinfectant that kills the virus. It just limits or interferes with the ability to infect and multiply. So depending on which medication we're talking about and which virus it was developed for, it can do this by helping to keep the virus from attaching, entering, and replicating in your healthy cells. But bacteria are an altogether different type of organism. And it's always important to make that distinction because the treatment is different, the outcomes can be different, and the complications can be different. So, Dr. Goff, let's talk a little bit about bacteria and what may be used to treat that type of infection.
Sure. So bacteria are very small living organisms, but they're made up of only one cell. And when you look at them under a microscope, they come in different shapes. They can be circular or a rod or spiral. They can be in clumps or pairs. And like a virus, they're found everywhere. But bacteria can actually reproduce on their own. They don't need to infect a host cell to make more bacteria. So when you have a bacterial infection, an illness that's caused by unwanted bad bacteria that's growing in your body, we all have bacteria in us and it's on our skin. That bacteria can release toxins, and it's the toxins that cause so many of the symptoms with bacterial infections, such as high fevers. And there are so many different types of bacteria, and there are good bacteria and bad bacteria, and we all have both of them in us. They live normally within our bodies and on our skin. For example, there's good bacteria that line our intestines and help to protect the cells there. But when you get bacterial infections, that's what actually causes illness in humans. And that's why we have antibiotics. Antibiotics are life-saving drugs, but they can also cause many side effects and problems. And they work by blocking important processes or functions that the bacteria actually need to survive. So they will kill the bacteria directly and stop it from growing. And there are many different types of antibiotics, and they don't all work the same way against all the different types of bacteria. For example, penicillin, the very first antibiotic discovered. I think everyone's probably heard of penicillin. It works by destroying the bacteria cell wall. So in essence, pokes a hole in it and makes it leak and it bursts open, and then that bacterial cell dies. So it's important to just understand there are different types of antibiotics, and they don't all work in the same way, and that they all work against different types of bacteria.
That's a great and really clear explanation. Thank you for that. So again, it's important to note here that you can have an infection caused by one or more viruses. You can have an infection that's caused by one or more bacteria, and you can have infections that are caused by viruses and bacteria at the same time. In fact, a classic situation is that somebody has influenza followed by bacterial pneumonia, or COVID followed by bacterial pneumonia. And those require different diagnostic assays and different treatment. So what this means is that your doctor is really going to need to know which infection you have, and you can't tell just by your symptoms. It requires testing because antibiotics and antivirals, which would be used to treat bacterial and viral infections respectively, are not interchangeable.
You're right. COVID-19, influenza, RSV, those are the three most common viral illnesses we're seeing right now. You can have them at any age. And like many infections, you can get them separately or you can get them concurrently. You can have COVID and the flu. You can have COVID and RSV. So you can even get infected and get sick with each of them more than one time. So it's really important to understand that you can have more than one at one time.
Absolutely. And also important to note that viruses exist year round. Right now, we have certain respiratory infections that are seasonal. That is, they happen more commonly during the winter in the United States. So during different seasons, we see different viruses and different infections that can overlap or happen at the same time, often because of international travel. So this goes back to what we said about being able to have more than one infection. We call that co-infections at the same time. And getting one infection or getting sick and having your body be compromised can sometimes make it easier for you to get other infections and illnesses. So when we're talking about COVID-19, influenza, and RSV, it's important to point out that the symptoms of these respiratory viral infections, for the most part, are indistinguishable. You can't tell by your symptoms. So you can't use that to rule in or rule out any of these infections. And that's because you can have overlapping symptoms. So for example, with COVID-19, flu, and RSV, if you were infected with any one of those or all three of them, you could have fever, cough, shortness of breath or wheezing, fatigue or tiredness, a sore throat, a runny or stuffy nose, muscle pain and body aches, headaches. A lot of overlap is what you're seeing between that. So when you have symptoms that are upper respiratory in nature, you're going to want to contact your healthcare provider and preserve your health and that of your family by getting the right diagnostic testing to know what you might be infected with and whether you should be treated. So Dr. Goff, tell us a little bit about how a doctor might decide on which treatment to recommend if they have an infection.
Sure. Well, it really depends on several factors, but the main one is going to be what organism is causing your infection. Is it a virus or a bacteria? Because taking an antibiotic, if your infection is caused by a virus, COVID, influenza, or RSV, the antibiotic is not going to help. In fact, taking an antibiotic when you do not need them can actually be very dangerous.
And that's a really key and important point. Not only dangerous for you taking the antibiotic, but dangerous for the population. We are seeing record increases in what's called antimicrobial resistance, meaning by taking these antibiotics when we don't need them, or taking them for prolonged periods, or trading antibiotics with other people because you have a cold or the sniffles, leads to bacteria that are resistant to the common antibiotics. So Dr. Goff, talk a little bit about that.
Sure. You know, when you go to your doctor with symptoms, the first thing the doctor has to do is try to determine if it's a viral or bacterial infection. And there are some rapid diagnostic tests that can help your doctor rapidly determine that. So we saw with COVID, the home testing, you can do that test in your home. In the doctor's office, they have rapid tests for flu and RSV. So that's the first thing. If you have a rapid test, that makes it very simple, but not every bacterial and viral infection can be identified by these rapid tests. And so you never want to pressure your doctor to prescribe an antibiotic for symptoms that you're not really sure which one it is, if it's viral or bacterial, because there are very important risks in taking an antibiotic. You can have harmful side effects, which can be deadly. You can actually develop antibiotic resistance, which we often call a superbug. So a superbug is a bacteria that's resistant to many and sometimes all the antibiotics that we have available. And so antibiotic resistance, superbugs, happen when bacteria mutate and the antibiotic can no longer get the job done. It's the bacteria's job to try to live. So they're always trying to find ways to mutate and resist antibiotics. But it is important to note it's the bacteria that becomes resistant, not the human, not yourself. You don't become resistant to antibiotics. It's the bacteria that becomes resistant to antibiotics. So antibiotics are what we call societal drugs. The more we use them, the less effective they become. And that impacts all of society. So that's why it's so important to only take an antibiotic when they're prescribed for you for an infection that your doctor has determined that is being caused by a bacteria. So when you go to the doctor, they're going to assess your symptoms and listen to you describe your illness. And with the help of rapid diagnostic tests, they'll determine, is an antibiotic right for you for this type of infection? So the key is to remember, antibiotics only work for bacterial infections. They do not work for viral infections such as COVID, influenza, and RSV.
Exactly right. And I don't think we can say that enough. Using antibiotics against viral infections will not help your infection or illness. It will not keep others from catching the virus. In addition, it could cause harmful side effects and may contribute to the development of bacteria that are resistant to antibiotics, as we just discussed. So to follow up on what you just said, Dr. Goff, when you're prescribed an antibiotic to treat a bacterial infection, it's important to not save any excess antibiotic, because that antibiotic is meant for your particular infection at that particular time. And don't share antibiotics or take any that weren't prescribed for you. They may not be appropriate for your illness. They could cause a delay in you getting the right treatment. And you can have interactions between taking an antibiotic and medications you're taking that a doctor has not looked at. So taking something that wasn't prescribed specifically for you is risky.
I agree. It's just so important that patients really understand to only take the antibiotics that are prescribed for them. And they are incredibly helpful when used for bacterial infections, but antibiotics are not risk-free. They do not cure everything. In fact, we're running out of effective antibiotics. And if you have a viral infection, COVID is still very prevalent in the US. We're now moving into influenza season and RSV. Those are viral infections. And, they will not respond to an antibiotic. So when you go to your doctor, many of these offices have these rapid diagnostic tests that can help determine viral or bacterial. The key is going to your doctor quickly. So you don't want to sit at home for a week with your symptoms and then call your doctor. Let your doctor help determine if there's medication that could be beneficial for you and resolve your symptoms faster. Telling your doctor, I just want an antibiotic, I don't have time to be sick, is never a good thing. Antibiotics have serious side effects, and every time we use them, we contribute to the development of antibiotic resistance and those superbugs. And those can actually be very untreatable because the antibiotics no longer work.
Absolutely. And again, it bears repeating that COVID-19, influenza, RSV, other viral infections are not going to be treated with antibiotics. They offer no benefit and only harm in that scenario. And now we know why that is. So for our listeners, if you have symptoms of a respiratory viral infection or think you've been exposed to one of these commonly circulating viruses, talk to your doctor. They can help see which infection you might have, and if treatment is recommended, which one. All of these infections have the potential to be severe, even deadly, especially for people who are at higher risk for severe illness because of their age, because of a health condition. So we want to be very thoughtful about preserving our health, preventing getting respiratory viral infections by wearing a proper mask properly, by being immunized against viral infections that we can be immunized against, and seeking proper diagnosis and, if needed, proper treatment for the right virus. Well, Dr. Goff, this has been a great discussion. Thank you for joining me today. Any closing thoughts you have?
Thank you. Just to remind patients, remember, antibiotics only work for bacterial infections. They do not work for viral infections.
Excellent. Well, thanks for being with me, and thanks to our listeners as well.